Why don't you like Medicare Advantage plans? I get this question quite often. We'll address that in just a minute. Hi, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. The short answer to that is it's not that I don't like Medicare Advantage plans. I realize some people love them, or some people think that they love them. And for some folks, the Advantage plan is the best option for them. I also tell you that I don't have one. I wouldn't have one. And so I guess you might say I'm a little bit biased, but there's a reason for that. And it's because I understand how original Medicare works. I also understand the way Advantage plans work. As somebody who has been in the health insurance business for over 40 years, I actually started in the business, the health insurance business, before managed care was even a term. It wasn't even a concept. So my history dates back, it predates PPOs and HMOs and copays and all this kind of stuff. So it's a completely different kind of approach from what you're going to get from most of the people you talk to, and even your friends and relatives that say, oh, I've got this Advantage plan that's great, I don't pay a premium, and I got free silver sneakers, and I've got dental plan and vision plan. I mean, who could ask for more, right? I will tell you this. People who love their Advantage plan have never really used it. Because once people use the plan and see how it actually works, then all of a sudden they don't like it so much anymore. Well, what I do when somebody wants to know what is it about Advantage plans and what's wrong with them, I'm free to share my information. Now, again, I'm not going to tell you that you should have this or you should have that, or you definitely should not have this thing over here. That's not my purpose. My purpose is to educate you and tell you some things, especially about Advantage plans, that you don't know. Nobody's going to bring up the fact that a lot of these plans have pre-authorization. According to Kaiser Foundation, about 80% of the plans out there, the Medicare Advantage plans, require pre-authorization in addition to referrals from your PCP, your primary care physician. So about 80% of these plans do require pre-authorization for one thing or another. You don't need to go to a specialist. So if you decide to go, we're not going to cover it. I mean, you'll get into things like that. That particular test is not warranted. You could get by with something less expensive. And here's the key. Most of the time when your claim or pre-authorization is denied, it's because of money. Not your money, theirs. So, that's something to think about. And there are countless stories out there about claims that have been denied. I had a lady write me the other day, and her husband has a heart condition and a pacemaker. And they were somewhere, I don't know where, and her husband felt like he was having a heart attack. They called 911. EMTs came, and they ordered a lifeline helicopter to take him to the nearest emergency room. The Advantage plan denied that claim. They said you didn't need to take a helicopter. $23,000 for a flight, and it probably was not a very long flight. Those life flight helicopters do not come cheap. But her Medicare Advantage plan, both of their Medicare Advantage plans, they have the same one, denied the claim. And she wanted to know, what do I do? Well, I outlined there is an appeal process. And I also sent her a link to an article by Kiplinger that said that not only are a number of claims denied, but most of them are usually overturned on appeal. But who needs that kind of hassle? I mean, seriously, if you've just had a major crisis, health crisis, and you're faced with big bills, big out of pocket, and so forth, who needs that kind of a hassle to have to fight with your insurance carrier to get a claim overturned, and get it paid? Not many people want to do that. But if you knew up front that there was a possibility you're going to have a battle or battles with your carrier over the level of treatment, the type of treatment, and so forth, would you actually go down that road? And I'd say most people won't. And so, what's the alternative? Well, the alternative is original Medicare. There are no networks, there are no pre-certifications, there are no referrals. I mean, it's whatever your doctor or whoever is attending to your medical need decides is medically necessary. And in almost every situation, Medicare approves the claim the first time out. So, something to think about. There's other things about Medicare Advantage plans that people are not really aware of. It usually involves changes in network, out-of-pocket maximum, which, I was going to out-of-pocket maximum $6,700, but don't worry about that. Nobody ever hits it. Well, that's fine as long as you're not one of those people that hit your out-of-pocket maximum. And as long as you don't hit your out-of-pocket maximum at the end of the year and you still need care next calendar year, a new clock starts. A new $6,700 clock starts. So that could be something more than you have budgeted for. It's just one of those things, life happens. The other thing along those lines, talking about year-end claims that are could be carried over to the next year, is let's just say that, whatever your problem was, you went to Dr. Welby and, you just love him and he's taken good care of you, but all of a sudden January 1 rolls around and Dr. Welby is no longer in your network. And, well, why not? Well, he's just not. But, you can go see Dr. Kildare. He's just as good, and he's a lot younger. Maybe you don't want to see Dr. Kildare. Maybe you want to continue seeing Dr. Welby. Unfortunately, if you have an Advantage plan, a managed care plan, you may not be able to continue to see Dr. Welby unless you're willing to pay out of pocket and pay cash. So these are things that, again, people just don't talk about. Most of the time, whether you're talking to a salesperson, you're talking to a friend that has this Advantage plan and, I don't pay anything for it, it's the greatest thing in the world, or you're talking to a carrier rep because you don't want to talk to agents. Most of the time, all they're going to talk about is the good stuff. They're not going to talk about the things that may cause you consternation. And unfortunately, by the time you find out about, I didn't know it worked like that, you have your private Benjamin moment. I joined the Army with the condos and the yachts, not this thing where I've got to follow your rules and so forth. By the time you find out about it, it's too late to do anything. And what I try and do is open people's eyes to the way they work, not to scare you. This is reality. This is the reality of the way these plans work. If you're comfortable with that, fine. Go have fun with that. You're not going to have fun with me with it because I don't need that kind of hassle in my life. And what I try and do is help my clients get the best value for their money with the least headache and the least hassle, because the more satisfied they are, the easier my life is, and that's just the way I see it. So this is Bob Vineyard with your Georgia Medicare Minute. Take care. Have a great day.